My illness is high-altitude pulmonary edema, also known as Hape. Hape is an illness that may occur when there's low oxygen levels and fluid fills the lungs, usually when you exceed 2,000 meters into the air. It is rarely considered fatal, and in only severe cases a person has to be hospitalized. The first case of this disease was documented in 1891, when a doctor died during the building of an observatory in Mont Blanc. The first diagnostic framework for Hape was created in 1913 by a T.H. Ravenhill. Hape is when fluid is accumulated into the lungs. It usually happens either in the lung tissue itself or in the space where oxygen is normally exchanged. The pathology of this illness is not very well understood. In the 20th century, H. Holdgren observed the high-altitude pulmonary edema and hypothesized it was caused by an acute failure of the left ventricle. He also reported clinical cases where the left atrial pressure was normal, even if the pulmonary pressure increased. High-altitude pulmonary edema also is not very common. There was a study where 3,628 people who had never before been in high altitudes traveled to Tibet by air, to an altitude of 3,600 meters. They were asked to answer questions on a questionnaire about symptoms that they may have occurred during the 2-week time period of their first arrival. The people also had physical examinations and appropriate laboratory tests. Out of all of them, only 1.9% ended up having Hape. There's another study done in Colorado, and only about 0.1 to 1% of the people were even affected. And a study in Mount Everest showed that 1.6 of the people ended up with Hape. Looking at the sex of a person, a woman may be less likely to develop high-altitude pulmonary edema, and other factors such as alcohol, respiratory depressants, or respiratory infections may increase chances of getting Hape. Many of the patients who come in with high-altitude pulmonary edema are young people, but is rarely seen in infants and children. When experiencing Hape, a person might notice fatigue or weakness. Other symptoms may include a cough, a low-grade fever, and in severe cases, someone might notice an altered mental status and hypotension. There are many complications to having Hape. One such complication is cyanosis, which is a blue tinge to the skin. Severe breathing difficulties when active or maybe even when resting also may occur. The chest might feel tight. Coughing up white frothy liquid also may happen. The person also might feel extremely tired, confused, or disoriented. Irrational behavior is another complication that is caused by the shortage of oxygen to the brain. There are many ways that someone can treat high-altitude pulmonary edema. Many times it is actually very simple to cure the sickness. If a person is experiencing the symptoms, take measures to help them cure it at home. They should not exercise, and they should just rest until they feel better. Also, the person would have to drink plenty of fluids and not smoke. If it can be helped, descend to a lower altitude. After having the symptoms of high-altitude sickness, it is best to descend to at least 500 meters and stay that way until all the symptoms completely disappear. The body should bring itself back to normal after 2 to 3 days. Oxygen treatment also may help. Increasing the amount of oxygen you take in can temporarily improve the symptoms of Hape. If a person is doing something that they know may result in them obtaining high-altitude pulmonary edema, such as climbing a mountain, then they should carry a portable hyperbaric chamber. A portable hyperbaric chamber is a large bag where a person would go into and be zipped inside. Air is then pumped into the chamber. The symptoms should improve significantly after 2 hours of treatment. Even though oxygen treatment may get rid of the symptoms, it is still important that they get to a lower altitude and seek medical help. There are also many medicines out there that can help with high-altitude pulmonary edema, although they are not nearly as effective as descending or oxygen treatment. Painkillers such as ibuprofen can be used to treat such symptoms as headaches. There is also anti-sickness medication that can help if a person is experiencing nausea or vomiting. There are many other medications that people can use to help alleviate the symptoms, but one of the best to use is nifedipine. It is usually used to treat high blood pressure, but it can also help treat high-altitude pulmonary edema. It decreases the narrowing of the artery that gets blood to the lungs. The effect of the narrowing of the artery is that it helps reduce the chest tightness and make it easier to breathe. It also causes a drop in blood pressure, so the person taking it should be careful. Medication should only be used if rapid descent cannot occur right away. It is only used to alleviate the symptoms temporarily. The drugs may also have their own symptoms, such as an upset stomach, difficulty sleeping, or mood changes, so it should be used only if it absolutely has to. Hape is something that should be taken seriously. If not, high-altitude pulmonary edema may lead to death. Hape may be fatal if left untreated for a few hours. One study showed that out of about 100,000 people, 7.7 could die from altitude-related illness. Although the mortality rate isn't very high now, it has been slowly increasing over the last decade. In 2010, Martina Navratilova, a tennis champion, was hospitalized with high-altitude pulmonary edema. Martina, who is 54 years old, went on a hiking trip up to Mount Kilimanjaro, which is Africa's highest peak. Martina's condition was common, which was the buildup of fluid in the lungs. She was helped down the 19,340-foot mountain and was taken to the Kilimanjaro Christian Medical Center. She was then flown to the Nairobi hospital afterwards just for fewer tests and treatments. Since Martina had never before climbed more than 12,000 feet, her body was not used to the change in air, and the fluid filled the lung tissues and space used for gas exchange. Because it is easy to bring the body back to normal after descending, it did not take long for her to recover. Although high-altitude pulmonary edema may rarely be fatal and can easily be treated, it should never be taken lightly. If symptoms occur, a person should take action immediately. Even if it may seem minor, but if no steps are taken to help cure Hape, it could easily lead to death.